Hey Steph, hey Michelle, the conference is about to start. I just realised that Charlie was in the plan was going to do the flashing, but she's not here. So are you guys monitoring the stream? Oh no, ignore that. Ignore that. She's doing it from the office. Charlie is doing it. Sorry, I see. Cool. Bye. Right, sorry. Sorry, shit.
Can I ask that you all please frame the interpreter in your shots? Thank you. Good afternoon. I'm Sarah Stewart-Black, Director of Civil Defence Emergency Management from the National Emergency Management Agency. And all of government response to the Whaikari White Island eruption is underway. We are working closely with the Bay of Plenty Civil Defence Emergency Management Group, the New Zealand Police, the Ministry of Health, the Ministry of Foreign Affairs and Trade, Fire and Emergency New Zealand and GNS Science. I'm joined today by Deputy Commissioner John Timms from New Zealand Police and Pete Watson from the Ministry of Health. They will each provide an update on the response and there will be a time afterwards for questions. Our focus is to keep people at the centre of this response by making sure that those affected receive the support that they need. The National Emergency Management Agency continues to coordinate the overall response effort and work with Bay of Plenty Civil Defence Emergency Management Group. The Prime Minister, Minister of Civil Defence and I visited the Whakatane community this morning. We were struck by the amazing efforts from first responders and witnessed firsthand the warmth and empathy that is being wrapped around those affected. Before you hear from the agencies, I would like to express our deepest sympathies to the families of those affected. This is truly heartbreaking. And for all of us in central and local government, iwi, private industry, we are all focused on working together to support the families and loved ones of those killed and injured by the eruption. I'll now provide a brief update on behalf of the Ministry of Foreign Affairs and Trade and GNS Science. So from the Ministry of Foreign Affairs and Trade, they have deployed a team of 3 to Whakatane to support diplomatic missions of affected foreign nationals. Their role at this point is to work with emergency services and response agencies to gather information and convey this to the diplomatic missions involved. The Ministry of Foreign Affairs and Trade assists diplomatic missions to connect with New Zealand agencies which can support them in providing consular assistance to their nationals. It is the role of diplomatic missions to provide this consular support to their nationals. Ministry of Foreign Affairs and Trade also connects diplomatic missions with New Zealand agencies which can assist in supporting family members who are travelling to New Zealand, and they will coordinate any offers of and requests for international assistance to New Zealand. In terms of conditions on the island, in regards to the conditions on Whakaari, White Island, monitoring equipment on the island is still functional and providing near real-time data. GNS Science will continue to closely monitor the situation on Whakaari, White Island. The web cameras indicate gas and steam jetting from the active vent area. While we've seen a steady decline in the seismic activity, there remains significant uncertainty about any future activity. GNS estimate that there is a 50% chance of a smaller or similar sized eruption over the next 24 hours, and that means a 50% chance of no eruption. It is estimated that a large eruption is unlikely at this time. If there is an eruption, there is an extremely low likelihood of ash reaching the mainland. It is possible gas may be smelt depending on the wind direction. The volcanic alert level remains at volcanic alert level 3, which is minor volcanic eruption, and this relates only to the volcanic activity and not the impact. Even small eruptions can have devastating impacts, as in the case with this eruption. It is important to note that this is a highly volatile environment and any advice must be seen in this context. GNS Science will be holding a science briefing at 5 p.m. immediately after this briefing. I'd like to hand over to Deputy Commissioner John Timms.
Thank you, Sarah. Kia ora, everyone. Firstly, I'd just like to say that this is an absolutely heartbreaking situation that we're all involved in. Police are working really hard at the moment to provide support for all the families and loved ones of those that were killed or injured in the eruption. I just want to say that we absolutely believe that everyone that could be taken from the island yesterday were rescued at the time of the evacuation. A number of flights were carried out throughout the day and no signs of life were seen. Today we are working with Defence and FENS to determine the conditions on the island, including gas levels in the atmosphere. This will be done by a drone able to carry specialised measuring equipment. This requires a boat getting into within 1 kilometre of the island in order to launch the drones. We are hoping to do this today. Unfortunately, we have had one attempt. The conditions have been against us and it's been too windy. We will continue to do so today if weather permits. We are taking advice from the best scientific experts, including GNS Science, who are considering 3 aspects of the recovery operation. Firstly, the condition of the island. Secondly, the requirements for those going onto the island, what they will need. And thirdly, the care and transportation of the deceased when they are recovered. We understand the desire from the locals and the loved ones to remove their family from the island. But we are working around the clock, we are working hard, and we understand what we need to do for friends and family. It has been released today, the nationalities of the 47 people on the island at the time of the eruption, living and deceased. 2 people from the United Kingdom, 4 people from Germany, 24 people from Australia, 5 people from New Zealand, 2 people from China, 1 person from Malaysia, and 9 people from the United States of America. I cannot break down those numbers any further until we have completed the DVI process. And so we will carry on working through that process until I can give you further information. I can confirm that there have been 5 fatalities. The 5 deceased have been transported to Auckland, where a post-mortem will be carried out. there are approximately 8 people missing and presumed deceased. When it comes to the investigation, I can confirm now that we will commence a criminal investigation into the circumstances of the death and injuries on White Island. The terms of reference will be developed over the next few days. This will be carried out in parallel with the WorkSafe New Zealand investigation. WorkSafe New Zealand has opened a health and safety investigation into the harm and loss of life caused by the eruption. As information comes to hand, we will provide updates to everyone. Thank you.
I'm now going to hand over to Pete Watson. Dr. Pete Watson is the Chief Medical Officer for Counties Manukau District Health Board. He's also Acting Chief Advisor, Child and Youth Health for the Ministry of Health.
Thanks, Hera. Kia ora koutou. First, we wish to extend our deepest sympathies to the families who have tragically lost their loved ones or had loved ones injured in yesterday's White Island eruption. Our profound thanks and appreciation to the first responders, all those at Whakatane Hospital, and all those who undertook the extraordinarily challenging task of retrieval of those injured, triaging, initial treatment, and then transfer of injured people to our receiving hospitals. The situation that I'm going to cover now is as it is now, but changes are expected and updates will follow as it evolves. Of the 31 people who are injured, 25 are now in our 4 regional burns units located in Christchurch, Hutt Valley, Waikato and Middlemore Hospital. 6 patients were transferred to Tauranga and Auckland. They've been treated and will be transferred to one of our regional burns units as soon as there is capacity. All of our burns units are now full to capacity. Our hospital's plastic surgeons, anaesthetists, nursing staff, intensivists and others are all doing their very utmost to treat the survivors, many of whom have sustained very severe injuries. Of those injured, 27 of the 31 have suffered greater than 30% total body surface area burns, the standard criteria for admission to our national burns unit at Middlemore. Many have inhalation burns that require airway support. The injured patients are aged between 13 and 72, and most, as you heard, are visitors to New Zealand. Our job in our hospitals now is to do the best we can to treat those who are injured. We believe we are up to the challenge and are currently assessing additional resources that are needed and will be needed to provide the care required. This is likely to include the early transfer of several seriously injured Australian citizens who are well enough to burns units in Australia. We will be able to provide more details on this as arrangements are firmed up. It makes sense to do this because of the proximity of Australia, the ability of patients to be safely transported, and that when they are transported, they'll be treated at home, closer to their family and their usual supports. It's important not to underestimate the gravity of the injuries suffered, the huge response being mounted by our hospitals, and the time it will take for some patients to fully recover. The volume of work facing our National Burns Unit at Middlemore Hospital in one day is equivalent to the normal workload that they would see in a typical year in the Burns Unit at Middlemore. At this stage, we would also say that people wanting additional information should do that through the New Zealand Police. Thank you.
Thank you. So we can now take questions for either myself or Pete or John. Any questions?